So starting today, Ontario doctors will be using HPV tests instead of Pap tests to screen women for cervical cancer. Last year, about 1,600 women across this country were diagnosed with cervical cancer. The switch to HPV tests is part of a larger push by health officials to reduce the number of deaths from cervical cancer. For more on the switch, we are joined by Dr. Christine Palme, family medicine physician. Good morning to you.
Good morning, and thank you for having me.
So let's talk about the switch. Why make the switch now in Ontario?
It's a big day for medicine. The reality is that this has been long coming. I mean, during COVID, it was hard to launch any changes. But up until recently, for the past 50 years, we've had traditional Pap screening for women to prevent cervical cancer. And now we have realized that the evidence would suggest that HPV testing is more specific.
Right, it sounds it.
Absolutely, it's more reproducible because Paps are typically cytological tests that are read by pathologists, so there's a bit of subjectivity. And the next rollout to this is having our patients be able to self-test at home with kits.
I saw this. Okay,
Yeah.
so sort of phase one of this. So how is this going to work, and how does it differ from a Pap test, just for for somebody going in to get one?
From a patient's perspective, you're still having an exam. You're putting your feet in stirrups. What really makes a difference is the efficacy of the test. So if a patient has a swab for HPV, if their cervix that's negative, we are reassured that she likely will not develop cervical cancer for a time period. And that patient's next test can be done 5 years down the road. Right now, in general, we're doing Paps on patients who are screening negative every 3 years. So it's less testing, first of all. We're also likely over-treating some cases that aren't necessarily precancerous. So this testing, by virtue of being more sensitive, it can actually capture results that will likely end up in treatment and pick those patients who need treatment and make sure that we're not over-treating those who don't. And the interval screening, too, is just easier, right? Medical access is difficult these days. Many patients don't have a primary care provider. So I think it's really important that when we look at screening options, we take the context of what's available. And Canada right now is going through hard times with access to primary care.
Yeah, so talk to me about this, the possibility of home testing. What does that look like?
Yeah, so the next phase hopefully will roll out soon. We don't know when, but patients will be able to ask for self-swabs from public health and submit them to public health, which will cause a chain reaction and then link a patient that needs testing to a primary care provider or a hospital setting. And, in terms of women, sometimes women don't like pelvic exams for a variety of reasons, and who really does?
Right.
Access. So that is really a huge win for medicine.
So this is starting today in Ontario?
It is.
So who should get tested at this point? If somebody's watching right now, they say, should I get tested?
Absolutely. So the screening guidelines would say that if you are 25 and sexually active, you should start screening. Now, there's some variances if you're immunocompromised, but in general, a sexually active patient at 25 should hook up with a primary care provider and start the screening process. And depending on the results, that will delineate what happens next. Also, and equally as important, we have screening, but thinking even more upstream, we actually have a vaccine against HPV, that is protective as well. So when I counsel patients on any screening, I sort of mention preventative care in general, which includes vaccination.
And is that at any age? Because I know they sort of target that grade 7 age right now, right?
Yeah, so we have school-based programs all across the country. It's variable depending on where you are. And according to NACI, our national guidelines, there is no upper age limit. So have a discussion with your family doctor, with your nurse practitioner.
Is this a game changer?
Game changer beyond belief. And well-timed. It is HPV Day tomorrow, and it is International Women's Day coming up.
That's true. That's true. Doctor, great to have you on this morning to walk us through this. We appreciate it.
Thank you very much.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.